So the first exercise I'm going to go over is a 6-way cervical. The purpose of the 6-way cervical exercise is to stretch the muscles on the sides of the neck and on the back of the neck, down into the shoulder blades. So the first thing that we do on the exercise is to turn the head all the way to the left. The patient will do it until they feel a pull here, hold it for a count of 3, and then slowly at this speed turn the head back to the right. Hold that for a count of 3, and they'll continue that for 5 repetitions. Going back and forth would count as 1 repetition. The second part of the exercise is where they'll try to bring the ear down toward the shoulder, not forcing it, but allowing the head weight to simply pull on the neck, not their muscles to pull it. So let the weight of your head simply pull. She'll feel the stretch along here, then she'll simply go back slowly like this again, go back to the other side, and let it pull, but make sure not going forward so that you let that stretch right there. Some common mistakes that are made is a patient will tend to have their head forward and go over to the side, and that stretches it differently than if their head is in neutral and goes over to the side. Do you notice that difference?
Mm-hmm.
Okay. Now, the third part of the exercise is a combination of the two. They turn halfway, and then they bring the ear, but instead of to the shoulder, they let it go down somewhat to the chest area or to the collarbone area. And that time, you'll feel the stretch go back down through this area. Do you notice that? And you'll also notice that as you do the stretch, if you turn the head, you'll feel it in a slightly different spot. Or if you turn back this way, you'll feel how it shifts it. What we want them to do is to have the head in the position where they get the best stretch through here. And again, it's only the weight of the head that is supposed to let it go down. So, there are really 6 positions. The first grouping of positions is turning the head to the right and left. The second is letting the head bend to the side, to the right and left side. And the third position is a combination where we turn the head part way, let the head flex to the side part way toward the collarbone, and then it stretches through this area. So that's the 6-way cervical stretch. Sometimes we'll call it a 2-way cervical stretch, and that will mean that we're simply doing the rotation movement, or we may call it a 4-way cervical stretch, which means we're doing the 2 rotational movements and the 2 side bending movements, or we may call it the full 6-way cervical stretch, where we add in the combination of turning halfway and letting the head come forward toward the collarbone and letting it stretch back through here. Okay? All right, generally we will have the person do a set of 5 in each of those 3 positions, and we'll have them do that twice a day. Another exercise that we'll do is going to be a thoracic outlet stretch, and that's where you'll stand facing the wall like this. You'll put your hand out to the side in this direction. As you do this, you should notice that there should not be significant pain through this area. It should just maybe feel a slight stretch. Do you feel any pain there?
No.
Okay. Now then, as you try to do this stretch, the key is this. You'll turn your head halfway, and you'll bend your ear towards your shoulder blade back like this, and then you turn your shoulders this way, and you'll feel a stretch coming along here and down your arm. Do you notice that?
Mm-hmm.
On patients with thoracic outlet syndrome, they'll actually feel tingling in their fingers. Do you feel that at all?
A little bit.
Okay, we may have to do surgery. Just kidding. The reason that you'll feel that is because it puts the muscle in the side of your neck called the scalenus muscles against your blood vessels and nerves right through here, where they go underneath the collarbone and out through the shoulder to supply your arm. So that is maximizing the stretch there, and you'll get a little bit of tingle. In people with thoracic outlet syndrome, they'll have terrible tingling in that. Okay? Now come back to neutral. You can let your arm down for a second. We're going to review it again. You'll put your hand up so your arm is straight out from the side. Turn your head halfway. Bend your ear back towards your shoulder blade area, and then rotate. Now sometimes people will rotate like this. They'll bring their shoulder up, and then they'll rotate around. We don't want to do that. You see the difference in the stretch when you do that? Mm-hmm. Instead, what we want to do is turn halfway, bend it, and keep your shoulders level, and don't turn your head only halfway. There you go. That's the position we want with your elbow locked, and then you'll get the maximal stretch. Do you feel that? Mm-hmm. That's what we want. Now that's the main position we'll start it on. That's the 1 position. The two position stretch is 45 degrees down, head the same way, and you'll rotate the shoulders and you'll feel that again. Okay? The three position stretch is you'll go 45 degrees up, turn your head, and you'll rotate and you'll feel the stretch again. This is the least stretchy position. Do you notice that? Okay? So those are the three positions for thoracic outlet center. Okay, on the cross arm stretch, what you'll do is be in a seated position and take your one arm and grab the elbow of the other one. Now, oftentimes people will take that and then they'll simply stretch across their body like this. That's not the cross arm stretch we want to do. What we want to do is to first slouch forward. This is one of the few times you can slouch. Then pull your arm down through the elbow at a 45-degree angle down and turn your head. When you do that, do you see how differently that stretches this area? That's the key, the slouch, and then pull down through your belly button and turn your head and body as you do it. Okay? That's the position. And then we would have them do the same thing the other direction. The key will be to have them slouch forward and to pull diagonally down through their umbilicus and not just simply twist. Okay? All right, now we'll start some others. Let's have you get on the table here and we're going to do the buttocks to heel. This is a low back stretch that we'll do. There are a couple of key things for this. First of all, and if you'll allow me, I'm going to use my pen as a pointer. You'd probably like that better than my finger. Okay, we want to make sure that the buttocks here touches down onto the heel as the first movement that they make. The tendency of patients is that they'll try to drop down here, or as they come back, they'll bend their elbows. But the first thing is bring the buttocks back to the heel here. Now, once it's to the heel, then the next thing is to bring the elbows down, and the next thing is to bring the head down slowly like this. And you'll feel the stretch through this area. Do you notice that? Do you also notice that the head is really what determines how hard of a stretch it is? We want to explain that to the patient too, so they understand again that it's a 3 out of 10 and that they only go to a 3 out of 10. So come back up for a second. At first, they want to come up again opposite, so they'll come up like that. So rear, elbows, head, and then coming up, it's going to be head, elbows, rear. Does that make sense? Okay, so when they go back, at first they may be hurt enough that all they'll do is go back with their rear. And that may be 3 out of 10. Then eventually they'll get to where they can do the elbow as a 3 out of 10. And then eventually they'll be able to do their head as a 3 out of 10. So then when they come out of it, they'll raise their head, raise their elbows, and then come back up this way. Okay? We're going to do the knee to cross shoulder. Okay, on the knee to cross shoulder, they should have their knees to where they're going to be at about a comfortable position, but not so their knees are all the way up tight, but also we don't want them a long ways out. The objective is we want them to be able to reach their knees to pull them up. So on a thin person, they can be down, they can be in a different position than somebody that's heavier, but try to bring them up comfortably as much as we can. Then they'll bring one knee up and grab it with the hand. Usually I have them do both hands just because it'll be easier for them. So if they bring that up, and the target is to go right through your chest to your shoulder, right here. That's the aim. The tendency of patients is to do this, or maybe to come straight up. You'll want them to go diagonal toward that shoulder, and then they'll feel in their back and in their buttocks. They'll hold it for a count of 3, then they let the tension off, not all the way down, just let the tension off, and then come back again. Okay? And they'll do that with each leg. And again, we would count 1 to either side as being 1 repetition. They may want to do 5 at a time each way, or they may want to combine them and alternate. Okay, then buttocks to heel is simply, knee to chest is where they come up, grab it with the other hand, and then bring them straight up toward the chest. And they'll feel that right at the belt line. Do you notice that? Now, sometimes patients will have the tendency to spread their legs like this, and then they don't get a stretch. The key is we have to have them keep them together and bring them up that way. Okay? Now the other one we'll go over is the Piriformis Stretch. That's the one where we do a figure 4. Okay, now not everyone is going to be as thin as you, so they may not be able to get their ankle onto their heel very easily. And so sometimes we'll have to let them have the leg down like this, or else they can't really bend it up that far. Sometimes they may not be capable of actually reaching the knee. And in that case, what we can have them do is to take a bath towel, put it around their leg, and they'll just pull on the towel, and that'll bring their knee up by doing this. We just have to work depending on what they can let us do. Or they may have someone in their family that can help them. The easiest piriformis stretch is this one. You'll be like this, you'll put both hands on your knee, and you'll bring this toward the middle of your chest or your sternum area right in here. That's the aim. You'll feel that primarily in your buttocks. Now the second phase of the piriformis stretch, once they get easy on that, is you'll grab the ankle here, you'll pull this back this way, and once you feel about a 3 out of 10, then you can start to pull this and you'll feel it in the buttocks more. So that's the second phase. And then the third phase of this one is where actually, on some people who are thin enough to do it, they'll come up like this and reach underneath and grab their thigh, reach through here and grab the thigh, there, and grab this on their thigh here, and they'll pull their leg up like this. Some people, if they have arms that are long enough, they'll go over the top and kind of come over the top, and they'll pull their knee up like this. You can feel that really stretches the buttocks. So there's some different ways to do that. But that's that's a third one that's on that. Okay? Now, I'm going to show another alternative to the piriformis stretch like that will allow you to stretch it on somebody that's maybe a little bit larger and there's no way this is going to work. So if you'll sit up for a second and face that way, and what you'll do is bring your left knee up on the table here and put it across like this. Okay? That's kind of in the same position like when you were down, almost crossing your knee. Then what you'll do is reach forward with your hands and reach this direction. Do you see how that stretches your buttocks there? That's another way. Sometimes they can do this, and the way they'll have to do it, again, because they won't be as skinny as you, is they may have to reach through like this. See how they could turn, and it would allow their stomach to go this way, and it still stretches the buttocks. And if they're hurting a little bit, they can support their weight there with their arms, so it's not quite so hard on them. And so they can turn their trunk like this and let their hand be up like this to hold themselves and still stretch their buttocks, but have a place for their stomach or their chest or whatever to go when it maybe is too much in the way the other way. Does that make sense?
Yeah.
Okay, so that's another alternative. That's a sitting piriformis. Okay? Now let's go back to the buttocks to heel stretch. This is another way to stretch the piriformis muscle if, again, they're too painful or they're running into some positional problems due to their size. And that is, let's say we wanted to stretch your right buttocks. The way we would do that is to cross this ankle, now lower your rear end towards your heels, hold that, then drop your elbows, then drop your head. Do you feel how that stretches the right buttocks? And that is a simpler way to do it again. They wouldn't be able to get in your position, but at least they could start it that way. Okay, you can come back up. All right, now let's have you onto your sitting with your legs out this way on the table. This is going to be the sit twist. Now on the sit twist exercise, I'm going to show both directions. One like this, and that's where they'll put their foot next to their knee. Now a lot of times, most times, people won't be as agile or skinny as you. And so they may only be able to put their foot so that it's kind of crossing like this. That's fine, they can still do this exercise. But for you, in showing purposes, we'll put it like this. Now the tendency of people is to do this. They'll take their arm like this and they'll twist this way, and that's what they usually end up getting mixed up and doing. That kind of stretches the back, but not the way we want. Here's what we'll do. We have you put both hands on the knees and come forward toward the knee, then bring the opposite knee and shoulder toward each other and turn the head as you do it. That way, do you see the difference in the stretch that it makes across here and across your buttocks on the side? The knee bent side is the one that stretches the buttocks, and the shoulder side is the one that stretches the back. Okay? Now, let's do the other position so that people can see it the other direction. So put this leg down, we'll bend this one up, And so this time we're going to have you go forward first, bring your opposite knee and shoulder toward each other and turn your head. And again, the same type of stretch with that. Okay? Called the Prom back arch. That's where we're going to put your hands right at shoulder level, and they're going to keep their hips on the table and not let them lift up. And then they're going to do kind of a girl's push-up, where you push up to straighten your arms but keep this in contact with the table. So do that for me, like that. Perfect. Now, how high should they go up? I would have them go as high as they can without it hurting here. They may feel a light pressure, but we don't want pain and we don't want them to feel like it jams. I'll often ask them, well, do you feel like this is going to make you worse if you do a few of them? They may say yes or no. If it's going to, then we don't want to do that. Now, in your particular case, it would make you worse because of your back problem. So we'll want them to go up to where they'll straighten their arms out like that, hold it, head level, and then slowly go back down. I'm not going to have you do that repetitively because you would be sad afterwards. Okay? It may be at first that they can't go that much. And so in those cases, I'll do a modified one where they'll have their hands like this. We'll have them keep their elbows on the table and just push up however high they can like that. It'll do similar, but you see how that's easier on your back. And so someone like you, I might straighten, change, and do that. I'm going to put this pillow under your head here so it's comfortable for you. And this pelvic tilt exercise is the easiest core strength one that we start with. Again, you'll put your knees so that your legs are comfortable, about like this. This is about the right angle for them to be bent, if they can do that. And then, here are the key things to remember on a pelvic tilt exercise. It's aimed at strengthening the abdomen. If they start using their thighs, they'll take away from the abdomen, and it's kind of a waste. So the things to remember are, first, to tighten the abdomen. Second, to flatten the back. And then third, to roll and tuck the pelvis. There. You can feel that in your abdomen? So relax it now. So it's tighten, flatten, and tuck. And then, or tighten, flatten, roll, whichever way you prefer it. So we first tighten, then we flatten, and then we roll. Now as they get better, you tell them to continue rolling. Keep rolling, keep rolling, keep rolling, and you'll feel it tighten your abdomen more. Hold it, and then let it go back down. You'll have 8-packs pretty soon. Okay? So that's the basic pelvic tilt. Now there's a pelvic tilt chair where I have the legs put up like this, and we pretend like I'm a chair. And then you'll do try to keep the angle about the same, and you'll do the exact same thing. You'll tighten, flatten, and roll. And now keep rolling, and hold it, count of 5, and then slowly undo it. You can see how that even works the more. So that's the second stage on that one. The key will be to help train them to not use their thighs, because that's the natural tendency to do that. Sometimes they'll have challenges getting themselves coordinated to roll their pelvis. You may have to take your hand and help them do that, or you may have to put your hand underneath their back and say, push down into my hand. Then they'll roll their pelvis. And if you'll know, because you'll feel that, and they'll go, okay, I see what you mean. And then after you've done that, you can say, put your hand under your back and flatten the back into your hand. And they have to roll and tuck their pelvis to do that. So. Okay, we're going to go over the psoas stretch as one of our other exercises. On the psoas stretch, there's 2 types. There's a modified psoas stretch, and then there's the regular psoas stretch. I'm going to show the modified psoas stretch, and I'm going to do it 2 ways. First of all, it's important to realize that the purpose of the psoas stretch is to help stretch a muscle that attaches to the front part of the spine and then actually attaches down into the inside of the thigh area along here. And so as a result, when a person is spasmed, can't stand up straight, tilting to one side, or that type of thing, this muscle will tighten down and will cause them some pelvic problems. And so that's the reason that we're working on this specific area. The area that we'll try and contact is going to be inside of what is called the anterior superior iliac spine, which is in the notches of your bones in the front that sometimes people will call their hips. Now, in this particular case, they'll be easy to find because there's not much covering them. So what you'll do is you'll go 1 inch in and 1 inch down, and right in that area, should be where you'll contact. You'll push down in that area, and then the object is to have the person who you're doing this on pull lightly in, and then you're going to stretch out as they resist very lightly. Now let go. No, hardly at all resist, just a little bit. And then I'll hold it here. Then I'll come in, and then resist very lightly as I pull out. So this isn't a contest at all. It should not be a strain. They should resist maybe a 1 out of 10 as far as intensity. Then come out. And then you'll come back in, resist slightly. There, do you feel how that's even loosened up just since we've been doing that?
Mm-hmm.
The object is you want to feel that give way there. Okay? Now, on some people who may be larger, it may be either awkward, difficult, or uncomfortable for you, just as far as a comfort level physically or a comfort level mentally, on some people to have your fingers there, and on those large people. And in those cases, what you can do is use the tennis ball. And what you would do is, that same area, you would take the tennis ball and contact that and just simply push down in that region right there. Can you feel that pressure?
Mm-hmm.
And then I'm going to pull out very gently. Relax. Just relax it. That's a little bit too hard. You want to do about a 1 out of 10. Okay, and then just resist lightly. There you go. Did that feel like it was doing something similar?
Mm-hmm.
So you can really do either one. On ladies, I think I would suggest if you don't mind using your fingers, you're perfectly fine, unless they tend to be larger. On men, I would tend to use a tennis ball, just because you'll be more comfortable. I don't know if they care, but I care on you, and I would rather have you feel like a comfort level that you're not violating anything or whatever. But I wanted to show you both types. If it was me and I was going to be working on lady, I'd go tennis ball, which would be appropriate. I think you can feel appropriate doing it with the men, and we could even have tennis balls. We might want to put these, you know what, we ought to make up tennis balls and put them in each of the rooms. And just have them there.
We've got enough, I can do that real quick.
Yeah.
Okay, now I'm going to show you the regular tennis ball, the regular psoas. On this one, what we'll do, I first demonstrate it to the patients, just so you know, before you come in and ever do it the first time, I always do this with them. I'm going to have them, my staff come in and do a stretch on you that is going to stretch a muscle that attaches to the front of your spine and out into your hip area. I'm going to show you the reason we're going to do that. Let's have you slide over to the edge of the table, and I'm going to have you take this and hold it there comfortably. Then let this leg hang over the side, and you'll feel how it stretches right down through that area there. Okay? Now, I want you to notice that. Put this leg back up, slide over to this side, and they'll always want to drop this now. Don't let them do it until this is pulled up. Hold that comfortably. Now let this one go over the side. Which one's tighter on you?
My right. I don't know. I think my left.
Whichever one you think. Let's test it. We'll do this, and you can do that with them. Now go back over to this side. Okay, now hold this one up and let that hang. Yeah, definitely this one.
Yeah.
Okay? And that's what I show them, so they understand why you're going to be doing this. Now the actual exercise itself, I'm going to do from this side so that you can watch it. Normally, I would want you to have the other knee bent about the same amount, but in this case, I'm going to move her leg down like this, so you'll see me better in this position. As I start to explain this leg part. Okay, when you do this leg part and they let it hang over the side, what you'll do is put your hand against their thigh, and it will usually be your right hand, or you're on the side. If you're on this side, or if I was on the other, it'd be my left hand, which would be the away hand from them, their head. And you'll put it on, and all you're simply going to do is use your weight to just give slight resistance. They should only push up about a 1 out of 10. Just barely push up and then relax. It's not a contest at all. In fact, it will work less effectively if it turns into a contest. And your stretch should be a maximum of about a 2 or 3 out of 10 as to how hard you stretch it, or else they're going to be home sore. So remember, we tell them to do a 3 out of 10 maximum. You should do a 3 out of 10 maximum. Okay, so the first thing is bring this knee up, put it in a position where they're stretching through here, but they're comfortable. Hold that there and tell them just to hold that. they'll let this hang over the side, and then I'm going to put my hand right above the knee here, and I'm going to I'll rest my other hand here on their hand. So they don't move this. And then I just use my weight. Now push up very gently with your right leg, and then relax. And I'll just lightly stretch. Push up very gently, and then relax. And I'll lightly stretch. Push up gently, and then relax. Do you feel how that started to relax it? Okay, now I'm going to go to the other side so that the camera can see this side of what I'm doing. Okay, hold that up. I'm going to put my hand like this, and I'm going to move. Normally I would have you in a position like this so you're using your body positioning and weight better, but I'm going to move to the side so the camera can see this. Now, push up lightly with this knee, and then relax. Push up lightly, and then relax. You'll see I have them push up for maybe 2 seconds, push up lightly, and relax. Or maybe even a second, and then I just lightly put pressure on. Okay, that's fine. Do you see how that begins to let go? If it turns into a contest, it will not.